Honestly, I don't think we need to get into an argument when I say that dutasteride is the strongest hair loss pill out there at the moment. But even though studies prove dutasteride to be 100 times stronger than finasteride in fighting hair loss, what is the most effective dosage and what is the safest dosage? That is the questions that we are looking into in today's video. As I just said, I don't think anyone will bat an eye if I say that dutasteride is by far the best option for hair loss out there. Unless you are Kevin Mann from Finasteride Cafe.
One of the reasons I prefer finasteride, though, is that there is a lot more clinical data on finasteride than dutasteride, which is one reason finasteride is FDA approved for androgenic alopecia and dutasteride is not. There's also, as I already showed, a lot of long-term data on finasteride that dutasteride doesn't have.
But we will also debunk his claims about dutasteride not being superior to finasteride in this video, so don't worry about it for a second, we'll get through it all. I hope you already are familiar with how finasteride and dutasteride works, and if you're not, here is a really short version. Your testosterone is converted to something called dihydrotestosterone, also known as DHT. This happens when your testosterone comes into contact with an enzyme called 5-alpha reductase enzyme, also known as 5-AR. DHT, the hormone created from testosterone by the enzyme 5-AR, is one of the components that is responsible for hair loss in men. And most scientists and the literature over the world completely agree that reducing exposure from DHT in your hair is the first defense against hair loss. Finasteride and dutasteride is classified as a 5-AR inhibitor, which means that they get rid of a lot of the enzyme responsible for creating this DHT from your testosterone. The theory is pretty simple. DHT is responsible for hair loss. DHT is made from the 5-AR enzyme and testosterone. Finasteride and dutasteride removes 5-AR from that equation, halting the process of creating DHT, hence stopping your hair from engaging a process called miniaturization that results in hair loss. That was the really short version, and if you want to know more about this process, you can just click on my channel and I have a bunch of videos about this subject. Now that we got that into order, let's get into the meat of the matter. How much dutasteride is the optimal dosage for hair loss? So the best way to answer this question is, of course, with this. The study is titled The Importance of Dual 5-AR Reductase Inhibition in the Treatment of Male Pattern Hair Loss. This study, led by Dr. Elise Olsen, compared the effectiveness of dutasteride and finasteride in treating male pattern hair loss. According to this study, both drugs inhibit the enzyme 5-alpha reductase, which converts testosterone into dihydrotestosterone, as we just talked about earlier, or DHT. The key difference between the two drugs is that dutasteride inhibits both type 1 and type 2 5-alpha reductase, while finasteride only inhibits type 2. In this study, 416 men aged 21 to 45 with male pattern baldness were divided into 6 groups. They were either given a 0.05 mg, 0.1 mg, 0.5 or 2.5 mg of dutasteride daily, 5 mg of finasteride daily, or a placebo. The study lasted 24 weeks with hair counts measured at 12 weeks and 24 weeks in a 1-inch diameter target area on the scalp. The placebo group saw a decrease in hair counts about 32.3 hairs after 24 weeks, which makes completely sense since they were not using anything to stop their hair loss, which also illustrates how fast hair loss happens without anything to stop it. The dutasteride group showed a clear dose-dependent increase in hair counts. The 0.05 mg dutasteride increased hair counts by 78.5 hairs at 24 weeks. The 0.1 mg increased hair counts by 94.6 hairs, and 0.5 increased hair counts by 99.9 hairs, almost 100. The 2.5 milligram dose led to the greatest increase, with 109.6 hairs gained at 24 weeks. For comparison, the finasteride group saw an increase of 75.6 hairs at 24 weeks. The results demonstrated that dutasteride, especially at higher dosages, was more effective at increasing hair counts than finasteride. This is due to dutasteride's ability to inhibit both type 1 and type 2 5-alpha reductase enzyme, resulting in greater suppression of DHT. In conclusion, this study suggests that dutasteride may be more effective than finasteride for treating male pattern baldness, particularly at higher dosages. However, we need to also talk about the side effects, because I know even though we just proved to Kevin that dosages as small as 0.05 milligrams of dutasteride is stronger than finasteride, we also need to take a look at the safety profile. This study, titled Finasteride and Dutasteride for the Treatment of Male Androgenic Alopecia, a review of efficacy and reproductive adverse effects, is exactly what we need for that. This study looked at the safety and effectiveness of dutasteride at different dosages, specifically at 0.02 milligrams, 0.1, and 0.5, compared to a standard finasteride at 1 milligram and a placebo. The trial ran over 24 weeks and included 917 participants. All of them were men with androgenic alopecia. First of all, dutasteride at 0.5 milligram was found to be more effective than finasteride and placebo in increasing hair counts. Of course, it makes sense with the placebo. The efficacy was dose dependent, meaning higher doses of dutasteride produced better results. So they completely agree with the previous study that I just presented to you. On the safety side, both finasteride and dutasteride were associated with some sexual side effects, such as erectile dysfunction and reduced libido. However, these side effects were relatively uncommon and often went away on their own or after stopping the medication. Dutasteride did show a slightly higher prevalence of sexual side effects, especially at the higher dose of 0.5 milligrams. Though the difference was not significant in short term. Why? Because dutasteride has a half-life of 5 weeks compared to finasteride's 5 hours. Of course, this is to be expected to be happening since the drug will stay in your system for a much longer duration. And by the way, the low 0.1 milligram dosage was still safer than finasteride at 1 milligram. So not only is it stronger than finasteride, it is also safer. In conclusion, dutasteride at 0.1 milligram appeared to be safer than finasteride at 1 milligram, with fewer side effects while maintaining a similar level of efficacy in treating male pattern hair loss. So even if you are taking 0.1 milligram of dutasteride, you will experience less side effects and still gain more hair than with 1 milligram of finasteride. I use 0.5 milligrams dutasteride daily, and I've experienced zero difference from finasteride except a lot more hair gains. But here's the tricky part. Both finasteride and dutasteride can't remove all of the DHT from your system. And if you take the lower dosage, you have more DHT in your body. So what do we do about that? I have a great video explaining how RU5841 takes care of the remainder of DHT in your scalp and how to further accelerate your hair growth. So if you really want to boost your hair growth to the max, make sure to check out this video too.